Hi, my name is Isaac Davis Jr. I'm with the University of Arizona Global Campus, and this is Psych 7510 Biological Psychology with Dr. Casey Firebaugh. Today's date is May the 14th, 2022. Today's final project, we're going to look at modern medicine for increasing memory in our older population. Humans are growing older, and that's a good thing. When it comes to life expectancy and fertility, the 20th century has witnessed two major shifts in its region where people are becoming more well educated and science and technology is continuing to thrive. Consequently, though, people and populations are getting older, which is creating some unique opportunities and some challenges. And one of the things that we're learning is that how to extend our life. We know that eating healthier, making great choices about what we put in our body, exercising, just staying on top of our health is allowing us to grow older. And that is a good thing. That's something that we all want to do. We want to live as long as we can possibly live on this earth. But as we do get older, things in our bodies, in our minds starts to change. And a part of this topic that we're going to discuss is some of these changes. Humans are growing older, and as I said, there's lots of opportunities, and there are also lots of challenges with humans growing older. Now, one of the things that we cannot avoid is diseases. Diseases are a part of our lives, as viruses are. One of the diseases that impacts a lot of adults as they grow older is memory loss. Alzheimer's disease is one of those that we must cure because it impacts us in such a way that it takes a part of our dignity away from us as we begin to forget things, forget important memories, forget important dates, and it just dehumanizes us. And no one wants to think about this, but as we grow older, we a lot of things starts to break apart. We start to have more uh, illness. We start to have more pains in our body. We start to really feel our age. As someone who was in his 50s, I can definitely tell you that my body as it was now is not the same when it was in my 20s. I feel a lot more pain. Um, I'm starting to get arthritis. Um, I'm starting to experience some memory loss, so I have to keep my mind active, and that's one of the things that medical experts will tell you that you want to keep your mind active to help with memory loss of the brain. And we also want to make sure that we understand any type of new medicines, any new type of treatments that are out there that can help with memory, with someone with their memory loss, if they're experiencing a memory loss. And a part of the presentation definitely talks about some new medicine that is coming out that is going to help with Alzheimer and hopefully improve the lives of those who are afflicted with it. And you also want to make sure as we grow older that we are utilizing technology and modern medicine that will help improve our lives, especially those who are starting to feel the impact of memory loss. A big part of growing older is as we grow older, our brain becomes less efficient and actually our brain begins to make more mistakes when we do our daily activities, whether it's on a personal or professional level. And it is hard to imagine new ways to look at things because our brain um, doesn't want to be taught new tricks. And you hear the saying, it's you can't teach a new dog, you can't teach an old dog new tricks. Definitely applies when you're talking about a older person who may be set in their ways and unable or unwilling to learn new things. Another challenge of growing older is that when attempting to focus one attention on one's ability to block out irrelevant information, that tends to diminish as we get older. Working memory, the ability to simultaneously um, retain and use like multiple types of information at the same time, that also decreases with age. And then your attention span also tend to decrease with age. That's why it's so important to continue to, as you exercise your body, you want to also exercise your mind. And then we're going to talk about the types of memory loss. And as we mentioned earlier, Alzheimer's and dementia are the types of memory loss. And it shows that in statistical data that more than 4 million Americans suffer from Alzheimer's disease, which is named after a German neurologist. Alzheimer is something that's not curable. And what it does is that it breaks down in the brain normal protein processing, which results in one's ability to remember specific data or specific dates or specific times or specific periods of time in their lives. But the great thing that I can say about this from the reading, it shows that although Alzheimer is not curable, there are some trial medicines out there that can help with um, patients of Alzheimer. And the research showed that patients who did not have a severe case of Alzheimer were temporarily cured for a short period of time before reverting back to um, succumbing to their diseases. So with this new medicine that's out that's being tested, it's promising to show that as modern medicine continues to advance, as modern medicine continues to make strides, that we are getting closer and closer to finding a cure for Alzheimer and the ability to increase memory loss, which I am excited about. By no means I'm saying that in the next year we're going to cure Alzheimer's disease or dementia, but I am saying that within the next 5 to 10 years, patients who are afflicted with Alzheimer, with dementia, and other memory loss diseases will find life more bearable and memory increases as medicine and technology continues to increase and grow. I want to thank you for taking the time to listen to me as we talk briefly about this. And to learn more about this, I think you should go to your library online at the University of Arizona Global Campus. And there's lots of great information about modern medicine and increased memory in older population and the different types of memory losses. Thank you very much, and I enjoy presenting this to you.